At some point in our lives, all of us are going to experience dark circles. I may be the first person to ever have told you that. Hi, my name is Caroline Robinson, and welcome to Set the Tone. Today, we're talking about dark under eye circles, and I have a lot of information to cover, so let's just get into it. At some point in our lives, all of us are going to experience dark circles. I may be the first person to ever have told you that. There's 6 different causes of dark circles. Most of us will at least experience the 6th cause, which is aging. What are dark circles? Dark circles are when you notice an increase in pigment in the under eye area. It doesn't always have to be related to hyperpigmentation. There can be vascular changes or even just thinning of the skin that is causing it. But in either case, it looks like darkness of the under eye. But what causes them? So there are 6 different causes of dark circles that we have identified as dermatologists, that we see often and we treat often. And the most common one that I see is actually related to genetics. So when you were younger, you may have had dark circles. And then as you got older, the darkness just increased in the under eye area. You may also notice that family members have the same dark circles, and it's just like the way that the eye looks in your family is consistent. That is most likely due to genetics and a hereditary type of under eye hyperpigmentation. But the other causes include post-inflammatory hyperpigmentation, edema or swelling of the under eye, increased vascularity, which means the blood vessels are starting to peek through a little bit more, thinning of the skin or looseness of the skin that's creating some shadowing. And then the last cause is aging, which is why I say that everyone at some point in their life will experience dark circles. We talked about genetics as a cause, but the next 2, post-inflammatory hyperpigmentation and edema or swelling, I kind of group those together because I see those together in my patients, and I'll tell you why. A lot of the people that come to see me have sensitive skin. They have a history of eczema or allergies or asthma, and that in and of itself makes the under eye just tricky to deal with in general. It's the thinnest skin on our face. It's oftentimes the first area on the face where we notice some irritation or inflammation when there's a breakout. So what I see is when you get an eczema flare-up, for example, you may get some swelling in the under eye, and then it's itchy, and we start to rub our under eyes. And I will tell you, I have seen so many times where patients have come in for dark circle treatment, but really the skin is irritated and inflamed from their eczema, and they've been rubbing. And that is important because when you start to go to treat the darkness in the under eye, you should treat the eczema first. Otherwise, that darkness will just continue to smolder. What that looks like is treating the inflammation, treating the itching, treating those symptoms and signs of eczema, making sure that the skin is calm. And then whatever pigment is left over, you can directly treat that with your pigment creams or your lasers or your microneedling. And you'll see this theme as we get into some of the other causes, but dark circles are one of the most complicated conditions to treat in dermatology. And it's because there's so much overlap in the causes, there's so much overlap in the symptoms, and there's also overlap in the treatment options that you have. Even without the rubbing of the under eyes, swelling itself can over time create some darkness in the under eyes. And the way that you will know that this is the issue that you need to tackle first is if those dark circles tend to be a little bit worse in the morning and get better throughout the day, because that's when the swelling is worse, in the morning. So, and for the swelling, I have found this very effective. You may have heard of this old wives' tale, is to use a cool spoon, the back of a cool spoon, to gently massage your under eye areas in the morning. I use a cooling wand, actually, just, we're a little fancy here on Set the Tone, but I use a cooling wand, and that really takes down a lot of the puffiness so that you can get ahead of that fluid collecting and you can get ahead of the darkness. So the next 2 causes, I group them together as well because they're related to your skin. And that's the increased vascularity or increased blood vessels kind of peeking through the skin and your shadowing. With the blood vessels, we see this in patients who have thinner under eye skin, that you can start to see some of those blood vessels through, or just some patchy pink, red, or purple peeking through the skin. And it can get worse in women during menstruation. But on the shadowing side, we actually see this in age-related dark circles as well, where the tear trough is a little bit sunken in or a little bit hollow, and depending on the lighting that you're using, it can look darker or lighter. That one is strictly related to anatomy. It's not related to blood vessels. And then there's just the true tear trough deformity, and this is where you have hollowness in the tear trough area. That is the area where your cheek meets your under eye. You can kind of feel it if you go ahead and feel your bone here. That's your orbital bone. That in the middle, there is almost like a spongy feel. That is your tear trough, and that is your under eye. And what happens when we get wiser is that we actually experience some of the most change on our face in our eye area. I will tell you that the number one complaint when someone comes to see me in the office for something cosmetic is the eyes, because yes, they are the window to our soul, but they are also so rapidly changing. First, we lose bone. I bet you didn't know that. Our orbit actually widens as we get older, and we have less bone supporting the eye area. In addition to that, there's ligaments that connect the bone to the skin. You can actually start to see those ligaments peeking through a little bit more as we get older, as that bone just kind of resorbs. Also, we have underneath the skin fat, and that fat has less support as well because it's not sitting quite right on the bone. So it starts to what? Fall. I know. And our cheek starts to fall as well. And all of that together creates a little more hollowness that starts to march from that tear trough all the way to our outer eye as we get older. When that fat starts to fall, we can have what we call fat herniation. And so the fat starts to peek through the skin. And I see this a lot in this cheek area where people are like, is that filler? What is that? And I'm like, that's all you. That's the fat. And so just be careful, because if you do have a lot of fat or a lot of swelling in this cheek area, it is actually not a good idea to get filler placed right in that zone, because it will make the swelling worse and it will make your under eyes appear worse as well. So those are kind of the causes of dark circles, but what can make them better and worse? And what are some tangible things that you can do right now today to get started? Well, we hear this a lot, especially for the genetic and hereditary causes of dark circles, that stress makes it worse. And that can be psychosocial stress, or it could literally be stressors on your body, such as alcohol or smoking. Those really stress your body and can make your under eye look worse. Another common thing is sun exposure. So just like hyperpigmentation anywhere else on your skin or anywhere else on your face, if you get more sun and you are not protecting that area, it will look worse. Some people actually think, let me go get a tan or let me get more sun just to even things out. Don't fall for that trick. It will make the under eyes look way worse. Just like lifestyle things, lack of sleep, not getting enough rest, we need all of those things almost more before the under eyes. We need to do everything, because the under eyes will not budge if you're not on your game. Like, you have to get sleep. We categorize under eye circles by type, and that guides our treatment. So it's really actually important for you to understand, yes, what originally caused it, just in case there's something you can intervene on there, especially with eczema and like if you're doing any lifestyle things that can be modified. But when we're ultimately talking about treatment for the under eye, it is very important to understand which type of dark circle we are dealing with. The first type is pigmented. So this is true hyperpigmentation, true melanin increase in the under eye area. And that can be genetic. It can have any of the causes that we talked about earlier, some more than others, but that is true hyperpigmentation of the under eye. In the treatment of it, we need to be targeting overproduction of pigment, whether it's with a cream or a laser or microneedling. The second type is vascular. So we talked a little bit about vascularity and increasing blood vessels peeking through the skin. And that is one of the subtypes of dark circles. The third type is structural. So there can be shadowing based on anatomy and based on lighting and positioning. But the skin itself, like the true color of the skin, has not changed. And then the fourth type is a mixed type, which combines, like, you can have pigmented and vascular at the same time. You can have structural and vascular at the same time. Sometimes you can have all three. In my experience, most patients fit in this mixed type of category, and it's very rare that there is only one type of under eye circle that we're dealing with. And that's important to know, because you will likely need to do multiple different treatments to address all of the types of under eye changes that you're noticing. You might be asking, how do I figure out what type I have? There's actually a simple test you can do. It's called a skin pinch, just not too aggressively. When you pinch the skin, you take a look at how it looks before you pinch it and while you're pinching it. Are you following? Great. When you pinch it, if the darkness stays the same, doesn't change at all, and it's often usually like a brown or darker skin tone color, that means you have the pigmented type. If you pinch it and the darkness gets worse, that's a sign that you have the vascular type. And that pigment will often look like pink, gray, purple. It's usually not a true brown or skin tone color. If you pinch it and the pigment gets better, that is a sign that you have the structural type of dark circles. And that's related to just shadowing and changing the skin position. And you could play around with light as well for that type. If you do overhead light, how do your under eyes look? If you do head-on light, how do they look? And if you light under the chin, how do the under eyes look? I'm going to tell you my approach for tackling pretty much every type of dark circle. I do this with my hair patients, and I do this with my dark circle patients. Because it takes so long for both of those conditions to improve with treatment, even if you're doing everything and you're being so consistent, my first step is, one, managing expectations. So planning for at least a year of consistent treatment or longer. And then two, getting some good camouflage techniques in place so you can just take your mind off of treating it. So for the under eyes, that involves getting a good concealer, getting a good color corrector, getting a good eye cream, getting some good sunscreen. Your eye will almost have its own skincare routine by the time you're done. Whenever someone comes to see me for anything cosmetic, most of the time they'll say like, oh, my under eyes or my smile lines. But sometimes it's just, hey, doc, I look tired. Everyone's telling me I look tired or I look sad. Those are like emotional cues and emotional things that we're communicating with our face that really, really like impact people's quality of life. So I do think treating the under eye area is kind of beyond a cosmetic issue, because if you're not tired and you're communicating, your face is communicating that you're tired, that's very frustrating. Set and forget under eye skincare routine, which is your color corrector, your very high quality skin tone matched concealer, your eye cream, your SPF that you're using on the under eye area. Then next is making sure that we have optimized all of our lifestyle contributing factors. So are we getting enough sleep? Are we being physically active? You recall in episode 2 that we talked about physical fitness and resistance training as a way to increase collagen and elastin and keep our structural proteins strong. So we want to make sure that we're staying physically active and exercising, of course, nutrition, avoiding alcohol, smoking. We want to optimize all of the lifestyle things up front. Now let's get into what we need to do at home to start to treat whatever cause we have. For the pigmented type, you want to lean into eye creams that have actives like azelaic acid, niacinamide, vitamin C. These are ingredients that help to regulate steps in the melanin production pathway or in the pigment production pathway, and they help to even the tone. For the vascular type, we're looking at different types of eye creams. Usually ones that have caffeine, because those ones can help to regulate the blood flow to the area, and that is going to improve temporarily the appearance of the under eye. I will put a link in the description to eye creams that I like and that cooling eye wand if you're interested. Now let's talk about what we can do in the office. So I like to start with skin quality. We've established our routine at home. You're coming in strong, you're ready, and you're actually going to respond better to in-office treatments once you have all of that taken care of. But the first thing I do for 99% of my dark circle patients is to work on this quality of the skin. Even in a eczema patient, even in a patient with age-related dark circles, across the board, the skin in the under eye ages faster, it's thinner, it needs a lot of support and help. And that's where we start. So starting with things like Skin Vive, which is a skin booster treatment that helps to increase hydration in the skin. That can be very helpful for the under eyes. You'll notice when you start to use a bunch of different eye creams that they're all very hydrating. Hydration is something that is almost a requirement for an under eye cream to have, because we know how dehydrated and how thin the under eye skin can get. Also, for skin quality, I like to use microneedling. Microneedling is a great treatment in the office that can help to thicken the skin. So all of those under eye changes that are caused by shadowing or thinning of the skin can improve a lot with microneedling alone. It also helps to clean up some pigment, which is great for that pigmented type. Another treatment that I really love is radio frequency and ultrasound, because we talked about how the under eye area ages, and we talked about the fat in the under eye and how it can slide down into the cheek. What we can do with radio frequency and ultrasound is actually start to tighten that skin, which can give some subtle lift to those fat pads and start to reposition them back into the under eye area. So here is a case of a patient in her 40s who came to me with dark under eye circles and some other things. But what we did was we did a few sessions of microneedling and then radio frequency ultrasound. And this really, you can see in the before and after, improved the appearance of her under eye and almost gave her more lifted, glowy appearance. And of course, there's good skincare. Remember, we talked about in the beginning, the in-office treatments really do help. Once you've tackled skin quality, you're in a great position to go into other treatments that are specific to your type of dark circles. For the pigmented type, I love to do peels or lasers, specifically pigment lasers. These can help to break and lift up the pigment and get you brighter faster. For the vascular type, I like to do lasers as well, but a different type of laser. So these lasers are more specific to blood vessels and vasculature, and that can really help to improve the appearance of the under eye as well. And then for our structural type, this is the type that benefits the most from dermal fillers. This actually applies to the age-related causes as well, but there are structural changes that we need to address. So filler is our antidote for structure. And I like to do really lightweight, thin fillers, little droplets of it in this area, because the under eye can swell so much. You really do not want to put a lot of product there. I think it was like a few years ago where everyone was coming in for under eye filler. Everyone wanted under eye filler because it was like the trendy thing to do. But what was missing, I think, in that kind of approach is that The cheek, as we mentioned, is also losing volume, and the cheek actually supports the under eye structures. In the eye itself, like not in the under eye, in the eye itself, there is no fat, there is no volume. It's just skin and muscle and like fluid. So filler really should not be in the eye area at all. It should be in the under eye and in the cheek. Correction of the under eyes should always start at the cheek first. Most people who have hollowness in their tear trough also have some volume loss in their cheek. And so the correct way to approach that is to build up the structures that support the eye first and then start to correct some of those fine areas of hollowness in the tear trough. We talked about filler for the structural type, but remember way in the beginning, I mentioned that most people have a mixed type of dark circles. And the most common mixed type I see is pigmented structural. So there's hyperpigmentation in the skin and there's also some volume loss. Those patients do really well with filler because we can correct that shadowing piece that's making that hyperpigmentation look way worse. I'm just going to tell you, that is the type that I have. So I know this intimately. And you can play around with lighting with this shoot to figure this out. But hyperpigmentation just looks worse in darker light and with shadows. If you can correct the shadows, you automatically get brightness and improvement in that pigment without ever touching the hyperpigmentation. Obviously, you want to do some treatment of the hyperpigmentation itself as well, but that's just because I'm telling you, if you have that, you might want to correct the structure first and then tackle the pigment. The pigment's going to take way longer and the structure is going to be a faster correction. But you can also get some lines under the eye, especially if there's volume loss, especially if there's structural changes. My approach is to actually tackle all of the things that we mentioned first before addressing the lines in the under eye, because the lines typically get better. They get better with a little bit of microneedling. They get better with a little skin tightening. They get better with a little filler. And therefore, the amount of line correction, which is our Botox and our neurotoxins, the amount of line correction that we have to do after we have gone and treated skin quality and structure and pigment is usually less. When I was in training, the analogy we used to use was, is there enough padding under the carpet? So if you think about it, like if there's not enough padding under the carpet, there's going to be folds and lines and wrinkles, and you wouldn't just go and like take an iron and try to aggressively iron them out. You would get some padding. Filler is the padding that will correct a lot of this, even out here to the crow's feet, it will correct a lot of those lines. So there are a lot of filler alternatives now on the market. You may have heard of PRP, PRFM, or Easy Gel, for example. I think most of those are great. They're newer. There's not as much evidence, but there are some great case reports with improvement with PRP and PRFM in the under eyes that look really promising, especially for hyperpigmentation and just some mild hollowness. But for severe hollowness and structural changes, filler is still my go-to. I'm often talking people out of treatments because one thing that is so important to remember with everything that we discussed today, a major consideration is that once you start to treat some of these things, you may run into other things that need to be treated as a result. Like when you do under eye filler, you may get swelling, you may get bruising. If you do laser, the laser may actually make the pigment worse in some cases, or it may not treat it entirely. And then when you do peels, this is where the type of dark circle that you have is so important, because if you do a peel in the under eye area, for example, a dark circle that is caused by eczema or allergies, it will get worse because those patients are already sensitive. I personally do not consider them great candidates for chemical peels in the under eyes. So once you start treating these things, you may run into other issues. That's why I think it's so important to start with the foundation at home of your core routine and being as preventative as possible and doing all of your lifestyle optimization. Especially with filler, you have to be careful because your barometer for what is normal starts to reset every time you get a treatment, especially with filler. And when it resets, you may convince yourself that you need more filler, but you actually don't. And what you want, a dermatologist or an injector or provider that has the ability to tell you no. That's what you want. So thanks for watching today. I hope that you learned a lot about dark circles and how we think about it in dermatology when we're approaching treatment. I hope that you learned something new. And remember, if you are struggling with where to start with your pitch test. Start to figure out what type you have and start looking into some treatment options. I'm going to leave a link to some past episodes that are really helpful for your skincare routine, as well as some links to eye creams and eye tools that I like. See you next time.